what everybody's been waiting for, of course, is the fat analyzer. And in terms of the fat analysis, of course, it's not about image. It's not about anything except health risk. And health risk, we find more and more that increased body weight around the middle, that abdominal obesity, that's a dangerous type of fat. It even secretes some hormones that increase the risk for atherosclerosis and, of course, increases risk for diabetes through the metabolic syndrome. We need to understand the concept of BMI, which I'm sure we all do, but just to refresh our memories, body mass index is a measurement of weight, but it's corrected for height. And a normal BMI has been said to be 25 kilograms per meter squared or less, an ideal being 23 kilograms per meter squared or less. Having said that, there was a study done, a landmark trial done, the InterHeart study with 27,000 patients that showed conclusively that waist circumference and or waist to hip ratio is a much better predictor of first myocardial infarction than is BMI. And the reason being that you can have a Sylvester Stallone standing there with hulking shoulders, and he'd have a BMI of 35. And are you going to tell him he's fat? I'm not going to tell him he's fat. So the point is that he's got a lot of body muscle and a lot of body weight, but it's all in muscle. So that's why BMI. But I think we can use a little clinical judgment. If we see a patient standing in front of us with a bigger belly and not that big muscle, I think we can pretty much go by BMI. A BMI of 30 or more is obese. A BMI between 25 and 30 is overweight. BMI, as I mentioned, of 25 or less is normal. So this Tanita TBF 300 allows assessment of total body fat, total body water, and total body weight. And it acts as a great broach to talking about somebody's weight issues. So it's always difficult as a health professional, and I think as a pharmacist, to approach somebody and say, you know what, we found more and more that weight's an issue. I think we better talk about that. It's just difficult to do, but this allows us to bring up the subject because people are coming to us and taking the test, and that opens up the discussion. Very interesting how this works, and again, we have to make sure the patient understands that this is a totally safe device. Even though it does send an electric current up one side of your body and down the other, it is a very small electric current. And the way it works is by measuring how fast that current gets around your body, because water conducts the electricity faster than fat. So we input the patient's height, their age, their gender, anything that the machine needs to calculate then BMI, total body fat, body water. Then it can, from there, calculate percentage body fat, percentage body water, etc. So we do that, and there is a chart available that you would get with this clinic that tells you by age and by gender what your normal would be or your ideal would be, and you use that as a target, whichever you choose. So Ryan again, please. Ryan's going to take off his clothes so that he can be accurately measured here. Actually, he's just going to take off his socks. Don't worry.
And, you have to be barefoot.
Oh, okay.
That's right. Aren't you happy you sat in the front row?
So we're going to input the machine now. So one caveat is we're going to take account of Ryan's clothes. So for winter clothing, we subtract 3 pounds. For summer clothing, we subtract 2 pounds. So that's the first thing the machine's asking us. So we've subtracted 3 pounds. And basically, it's a step-by-step. The machine's going to tell you what to do next. So next is gender, I think.
Yep.
So he's putting in male and
then my age, 33.
Okay.
And then it's going to ask for my height. And for a more exact height measurement, we also have these statiometers, which will give you a much more exact height measurement when you're actually doing your clinic. I'm going to input my height here. And then it asks for a goal. And I think you were just discussing that. I'm going to put in my ideal. I can choose either a normal or ideal. I'll choose ideal. And the ideal is, I think it's 23% body fat.
For this particular individual.
Right. And now it's going to ask me to step on the scale.
And you would have got that ideal from the chart I was referring to. So, but I think he's fudging it because his results are too good. So he's getting a printout now. While he's doing that, I'll explain what some of these terms mean. The body mass index we've talked about. Basal metabolic rate is basically BMR is the short form. It's basically how many calories we burn off by just sort of sitting around. It's what our body just will burn off. And this individual here is 29 years old, male, 5'11", 199.6 pounds, BMI of 27.8. So this individual is overweight. BMR burns off actually about 2,000 calories a day. So theoretically, if this person was sitting watching television and not eating potato chips at the same time, and was just taking in 2,000 calories a day, they shouldn't gain or lose weight. In terms of fat percentage, it calculates that. Fat mass in terms of pounds, how much actual fat there is. Fat-free mass, so other than fat. Total body water, and then the desirable ranges. And this particular reading is a little bit different than what the machine's giving up to the bottom here. So what Ryan's got on his readout is a target body fat percentage, and he's inputted 23%, as we said. Predicted weight, it says, is 180.6 pounds. So by predicted, it means what his target would be if indeed he was to reach his ideal body fat percentage. So 180.6 pounds. Predicted fat mass, again, what it would be 41.6 pounds if he was to meet his ideal body fat mass. And he's actually got body fat to gain. So